Hi, I'm Dr. Jelen Israel Civic with Premier MD Care here in Fort Myers, Florida. We are an internal medicine concierge practice, and today I want to talk to you about a very common disease state that we see in the primary care setting, and that's migraine headaches. And this is kind of a personal one for me as well, because I used to suffer from frequent chronic migraine headaches for about 18 years. So first I want to talk to you guys about how or what the frequency is of seeing migraine headaches in the U.S. population. So about 18% of the people who get migraines are women. So it's a lot higher number in women than in men. Only 6% of people with migraines are men. And in these people who do get migraines, it reduces their ability to function and do their day-to-day tasks by about 51%. So it drops the productivity. So it really impacts society as a whole. So first of all, what is a migraine? Because sometimes we get a headache and you hear people say, oh, I have a migraine. But really there's certain things that you have to look for to clarify that someone actually has a migraine headache. So we use the acronym POUND. So P is for Pulsatile Pain. So it's more of a throbbing, nagging pulsatile pain. 1 is for it can last for 1 day. It can be actually anywhere from 4 hours up to 72 hours, unfortunately. U is unilateral, meaning the pain is typically on one side of your face or head. And then N is for nausea or vomiting is usually associated with it. And D, the last part of POUND, is for the fact that the pain is disabling. It actually interferes with your day-to-day activities. So if you have 4 out of 5 of these symptoms, it's about a 92% probability that you are suffering from a migraine headache. If you have 3 out of 5 of these symptoms, it's about a 64% chance that you have a migraine headache. So you have to be careful as far as headaches go, not to just think that, I have a migraine and ignore it. The reason being that there are other things that can cause a headache that are not migraines, and that could be true medical emergencies. One of the things could be a condition called acute glaucoma, which is a condition in the eye, and that can cause terrible pain in just one eye or behind the eye. The other one is an actual subdural hematoma or bleeding in the brain. Usually that happens after someone's fallen or hit their head. And typically these people complain of the pain being as the worst headache in their life. Pain around the neck and difficulty moving your neck from side to side is another alarming factor to look at. Uncontrolled blood pressure or a hypertensive crisis where the blood pressure is so high that you really need to go to the emergency room to have it treated. And also cluster headaches can be sometimes confused with migraines. These are less common. They usually occur more commonly in men than in women, and it's typically almost like an ice pick type of sharp stabbing pain in one eye, and it's associated with excessive tearing.